My name is Dr. Rosalyn SandoToe, Master THA. 2020, I joined the Merck Foundation and was able to do the course of Sexual and Reproductive Medicine. I work at the James Davis Hospital as an OBGYN specialist. The Merck Foundation Scholarship information was sent to the Liberia Medical and Dental Association's office. They posted it online asking doctors that were interested to apply for the program. And that was what we did. Then I heard that our names, those that were accepted, their names were called on the National Radio of Liberia, the Liberia Broadcasting System. And that was how we got the information that we were accepted for the program. And that was how I started the online program with the South Wales University. A few months ago, we started running the outpatient department at this facility. And we were able to access a lot of patients. Some came in that needed surgery, emergency surgery. There were others that we had to plan surgery for. There were others who came in with diabetes in pregnancy. We refer to it as gestational diabetes. And we were able to manage them and discharge them from the hospital. Here we were also equipped with the knowledge from the Merck Foundation, because it is evidence-based knowledge that we acquire. We also acquired some of the knowledge when we did the specialization program in Liberia that was sponsored by the Mount Sinai University. And for the reproductive aspect that we learned from the Merck Foundation with the South Wales University, it equipped us to also enable us to treat many patients that came in with infertility problems. So we were able to get the wife to invite her husband. We were able to test both parties, which enabled us to treat the couples, among them those that were having the problem of infertility. Like the females would come, they would bring their husband, some with low sperm count. The female, some had low progesterone, and we were able to put them on a treatment and they were able to conceive. And it's not only from Monrovia. We have patients coming from Sino, Magibi, Bon County, and other places. And these were people that could not afford to even pay for the laboratory work. And then at James Davis, we cannot do the assay of infertility, like the hormonal assays. We could not do them here, so we had to send them out, and many did not have the funding. So we had to give them time to find the funding in order to be able to pay for the laboratory work and then bring the results back to us. In the area now, what we are doing in order to disseminate the information that we gather from the training program, we're able to teach some of the midwives, those that were interested, how to do ultrasound. There were others we had to train when certain cases come in this manner. These are the things that you do. So we were able to also pass on the knowledge to some of them, even those on the GYN ward where we keep patients that come in with like gestational diabetes. We tell them what to do. Like you have to monitor the blood sugar every 2 hours in order to know what the blood sugar is, so that these women will be prevented from having macrosomia, that is very large fetus. And most often they might end up with C-section, so we have to prevent that. Made them to use the insulin wisely by tracking the laboratory results that come in from these patients. And then to also teach them what type of diet they should be on, so that it will also encourage the patients to follow the diet when they leave the hospital. Well, I would like to say thank you to Merck Foundation, because there were a lot of things that I learned that I did not know before, especially when it comes to reproductive health. There were drugs that we were using here, like the common ones, clomiphene citrate, metformin. That was all that I knew about. But Merck Foundation was able to bring about the knowledge of many other drugs that you can't even find in Liberia. And how the equipment that they also encourage us to be able to use that you can't even find in Liberia today, especially when it comes to artificial insemination. We don't have those equipments here. But we were able to learn during the program how to use them and how important they are when it comes to reproductive medicine.
And finally,
I would like to recommend that all the Liberian doctors that are being trained now should make use of this program, because you learn a lot when you are out there, because medicine is not stagnant. It is evolving. And there are a lot of research that people are doing out there that we cannot even do here. So we should always make sure we make use of these programs when they are available to us, so that we'll be able to learn those new evidence-based practices and be able to apply them to our society here. So I want to encourage all Liberian doctors to take part when these programs come out.